All right. So I know we normally talk about drugs. Uh, this time we're going to be talking about a lot of the legal drugs, at least to start out with. Uh, a lot of these are psychomimetics, so they change the chemistry in the brain, which makes you addicted to them, and that's why people abuse them, right? So the first one we're going to talk about is LSD and LSD-like hallucinogens. LSD was developed back in 1938. Still one of the most potent hallucinogenics around. Used to treat alcoholism and mental illness with it. Currently, there are no therapeutic uses, so it is a class 1 drug. Like, completely illegal. Really not sure on the mechanism of action. And that's what it is for a lot of these drugs that work in the brain. Kind of like with a lot of the drugs for depression. We're like, this is what it does. Maybe, not sure exactly how that helps, but serotonin's important, right? Same with this. Serotonin's important. Suggestions that the serotonin 2A receptor is agonistic with it in some spots, but also antagonistic at other spots. And so, yeah, we're not sure exactly how LSD works. Usually peaks around 12 or last up to 12 hours, so about half a day, and peaks around 1 to 2. Synesthesia may occur. Synesthesia is like where your senses are kind of crossed, like saying you can see sounds or hear colors. That's synesthesia. It's also a potent stimulant, so you'll see stuff like increased heart rate, dilated pupils, increased respiratory rate. Lactogenic acid diethylamide is what LSD stands for, and it's associated with flashbacks. So flashbacks, it could be you took LSD once, years later, you haven't had LSD, maybe you take another psychostimulant or some other psychomimetic, and boom, you'll have a flashback, right? So you'll have like hallucinations again. That can happen with LSD. There are other LSD type hallucinogens, tryptamine derivatives like psilocybin, that is magic mushrooms, fall into this category. DMT also falls into this category. That's a synthetic one. And then phenylethylamine derivatives like mescaline. Mescaline comes from the peyote cactus. Sometimes they just call it peyote. You can make a tea from it, and it will cause hallucinations. And DOM is pretty similar in structure to this, which is like another synthetic form. And so if you look, so here's your mescaline, here's your DOM, amphetamines, norepinephrine, pretty similar in structure. Kind of similar in structure because, again, these are stimulants, pretty similar in structure. And then a newer drug that is on the market, N-Balm or Smiley's or 25I. It's a newer potent serotonin agonist. With Smiley's, people tend to be more violent. The stimulatory effect is stronger, and so you also see a higher risk of death with taking this drug. Psychomotor stimulants like amphetamines, again, these are all stimulants. They increase norepinephrine and dopamine. That dopamine causes the feel-good feeling, the euphoria. People who stop using amphetamines, typically they have a very long night of sleep, day of sleep, followed by a crash. This crash is a feeling of depression. The person might be really disagreeable and they have this strong craving for the drug. People who abuse amphetamines also end up getting a psychosis, which is pretty similar to what you see in schizophrenia. Cocaine is a psychomotor stimulant. Europeans discovered it in 1855, but South American natives have been using cocaine for a really long time. They just take the coca leaf where it comes from and chew it up. Gets rid of their hunger, gets rid of their fatigue. Also, they brew teas for it for people who get altitude sickness. From its discovery up until 1914, it was a wonder drug. They put it in everything. They used it to treat alcoholism. They used it to treat depression. They used it to treat just about anything. And then they went, whoa, this is really addictive stuff and not great for you. You probably shouldn't just be putting this in everything. It is a class 2 drug because sometimes it is used in the medical community, especially for certain surgeries, right? You cannot smoke cocaine, but you can alkalize it and turn it into a crystal, which makes crack, and you can smoke crack. And smoking crack is the preferred way over cocaine use because it gets into the system a lot quicker. It is more potent. And then cocaine, like, you can snort it, right? You can eat it. A lot of it gets cleaned up in first pass. When you snort it, it doesn't get through first pass, but it can cause nasal irritation and perforations in the septum. You can inject it, right? Lots of different ways to do cocaine. Amphetamines kind of falls into this group too, called designer drugs. Designer drugs are drugs that are slightly altered derivatives of original drugs. So like amphetamines, a lot of these are going to be based off of like a cocaine stimulant. Amphetamines like meth would be a designer drug, right? Meth is a type of amphetamine. It's methylamphetamine, right? Speed. Other designer drugs would be stuff like MDAs, the love drug, or MDMA, ecstasy, or Atom. MDEA, Eve, or a newer type called Molly, which is supposed to be just a pure crystalline type of MDMA. All these are stimulants that come with euphoria. Being stimulants, though, they can also produce anxiety, panic, paranoia, heart attacks, death, coma, all the good stuff. And then we get to phencyclidine, or PCP, angel dust. When they developed PCP, it was going to be used as a general anesthetic. And so you would put people under using PCP, but when they came out, they had some serious delirium. They were not right in the head, and they're like, yeah, probably not the best general anesthetic to use. But it is still used today for primate immobilization. So vets use phencyclidine to put primates under. Its mode of action is it's a glutamate antagonist, specifically the NMDA receptors. And remember, glutamate is an excitatory one, so if you break it down, you're going to be able to put people into sedation or hypnosis. People who use PCP have disorders of the body image. It's pretty common. It's like they would look at their fingers and be like, wow, my fingers are really long, or my arms are really short, or whatever. Like, their vision on their body looks different. They also have slowed reflexes, ataxia, and a depressive state, again, because it is a sedative. They can become paranoid. And with this one, you get pretty quick tolerance. And so you have to keep stepping up your dosage. And then marijuana. Marijuana has a sticky resin with psychoactive properties, these cannabinoids. You can harvest just the sticky resin, and it makes a drug called hashish. it has been legalized in a lot of states. It's still illegal in the United States, so federally it's still an illegal drug. But a lot of states have legalized it. It is a class 2 drug because there is some medical proof about it helping people. That legalization has some strains with some really high THC, and something that you see is as the THC goes up, other cannabinoids go down, and so like CBC, cannabinol, tends to be therapeutic and has been used to treat like seizures, which we will talk about maybe. And so you can also breed the opposite strains. Some people have some that make a lot of CBC and not a lot of THC. But it's the THC that has the psychoactive properties. The mechanism of action, not completely understood, but we do have cannabinoid receptors in our brain, on our neurons. You really see a lot of them on the presynaptic neuron, and it looks like they are important in learning and memory. And something you see is as people use marijuana, their memory decreases, their ability to remember stuff decreases, right? Which decreases learning. It does increase the mesolimbic system dopamine, so that gives you that reward. That means you can get addicted to it. The euphoria comes with smoking marijuana. It kind of comes and goes, along with increased sociability. When you hear conversations of people who have been smoking marijuana, it normally focuses on the here and now, and not so much about stuff that happened in the past or things that are going to happen. It's all about what's going on right now, which is kind of a unique effect of this drug. Time seems to pass slowly, short-term memory impairment, chronic use can include psychosis, anxiety, dysphoria, paranoia, decreased sperm count, and sporadic ovulation. So menstruation might come and go, and it's not going to be regular like a 28-day cycle. Has been investigated to treat nausea, vomiting, pain. Yeah, drobenol, it's an analog, and it will help stimulate appetite for patients with AIDS. So smoking marijuana, you typically get munchies, right? It is an appetite stimulant. You can take stuff from it to stimulate the appetite in people that don't have much of an appetite. So there is some medical use for marijuana. That's why it's a class 2. We'll stop there and then pick up with anti-epileptic drugs next.